Good morning. I'm here to talk with you and introduce the main concepts that we will talk about this semester in our environmental health course. The slides that I use for our narrated PowerPoints will be drawn from the book. I'm using the slides from the second edition, but the similarities between the first and the third edition are very great, and so you could possibly use other editions. For our introduction to environmental health, I will go over the learning and objectives for this module. I will ask that you read the chapter, you review the presentation, and by the end, you should be able to describe how environmental health problems influence our lives, have a definition for environmental health, identify current issues in the field, and describe employment opportunities. In addition, I hope that you can describe impacts of what population growth does for the environment and have some knowledge about major events in the history of environmental health. If we think about our national goals for health, we can refer to the Healthy People 2020 goals. These are guidelines set out by the organization healthypeople.gov, which is associated with Centers for Disease Control and Prevention, and they have a list of goals or measures we should achieve. Goal number 8 is focused on environmental health, and it asks that we can promote health for all through a healthy environment. Some examples about that goal focus on areas of the environment that we need to target, like outdoor air quality, surface and groundwater quality, not only for health of the environment, but for drinking water. We need to control toxic substances and hazardous wastes. We need to make sure our homes and communities are environmentally sound and not causing us illness. We need to have strong infrastructure and surveillance systems. And we also need to think about how world environmental health or global environmental health affects us all. When we think about the environment, we can think about 3 focal areas of the environment and how they are related to determinants of health. The first is pollution, the second is population, and the third is poverty. When we think about pollution, we can think about things in the environment that are present at concentrations greater than above normal that can cause illness and injury. One example is combustion of fuel. This fuel for your car, it's what you do to heat your homes, it's how you get electricity, and this combustion or burning puts pollutants into the environment. Pollutants may be associated with poor air quality, or they may be associated with changes in gases that cause warming. So combustion of fossil fuels can contribute to greenhouse gases, which can cause warming of the environment. And with that warming, we might see a change in where insects can thrive. Overpopulation, especially in countries that are still middle and low income, demonstrates that we cannot continue to grow with the same resources. If we reach 10 to 12 billion during the 21st century, we will exceed our ability to feed, adequately give water, and support the population through the resources. The result of overpopulation is crowding, contribute to poor conditions, and it's a major component that influences environmental health. How populations grow, how they migrate, where they move to, the shifting demographics of populations all contribute to components of environmental health and are major determinants of health worldwide. Poverty is strongly linked to population growth and is one of the well-recognized determinants of adverse health outcomes. And the reality is that the greatest environmental health burden falls on people that are low income. both in the United States and worldwide. So environmental health becomes a social justice issue. And it's one of the reasons that I got engaged and interested in the environmental sciences and in environmental health. The significance of the environment for human health cannot be underestimated. Exposure to hazardous agents is associated with 1/4 of deaths worldwide. And this is agents that if the environment could be easily changed or modified, we would reduce exposure and prevent those deaths. Examples of these hazardous agents include microorganisms, toxic chemicals and metals like lead in water, pesticides that we use to help us produce food, yet can get into places where we don't want them to, and ionizing radiation. Environmental factors are thought to contribute to many forms of infectious disease and chronic disease, such as cancer. A large proportion of the burden of disease is associated with environmental sources, and this is shifting. We have a great understanding of how environmental sources contribute to infectious disease, or we have a growing understanding of how they contribute to chronic diseases. Prevalence and mortality from asthma has increased, high percentage of children with lead levels that are elevated, and of course globally we see air quality degradations, so that it's not even safe to breathe the air. You don't really have a choice. Most locations undergo what's considered an environmental risk transition. It's associated with development of the economy in each country. And what it means is that before this transition, most of the environmental disease is associated with household risk factors. Low access to drinking water, low access to fuels that allow you to cook safely in your home, and poor quality foods. When countries go through economic development, people often get access to drinking water, they get access to electricity that allows them to do cooking that they might be doing with wood and prior to access to the electricity, and it transitions most of the environmental burden from the household to the broader environment. After this transition, there are new environmental problems that take hold. This could be greenhouse gases that cause climate change. It could be ozone depleting chemicals. It could be because of increased fuel consumption, either through cars or electricity, decreased air quality. These are just some examples. And so the burden shifts from individual household risk to community level risk that's harder to control. In addition to the environmental risk transition that countries face, countries also face what's called a demographic transition, which is a change in time over the population's mortality and fertility. And what happens is that there's big shifts in age of the population and gender, so that we see in places like the United States, we have an aging population, not as much young people, whereas countries that are still going through the demographic transition have higher fertility rates, have much higher infant mortality rates, and the population is relatively young. An epidemiologic transition, which we'll also talk about in terms of changing demographics, changing risk factors for health, is typically a shift in the patterns of illness and death from causes related primarily to infectious diseases and communicable diseases to causes associated with chronic, non-communicable, and often degenerative diseases. So what we see is that before, when poor water quality was causing young children to succumb to diarrheal disease and die, once we improve water quality, we may see that it's long-term health effects from water contaminants like lead that cause chronic disease, or a shift as you grow older, you have more likelihood to get chronic disease. When we think about all of these factors together, improved household environmental conditions, shifts in the age distribution of the population, and reduced infectious disease, we end up having more people living for longer periods of time, and it's a major increase in population. And some of the consequences of population growth include increased urbanization, a stress on the environment's ability to support the population, which results in things like lack of access to water or water insecurity. We see food insecurity, and we also see environmental damage like loss of biodiversity. Today, I saw in the news that giraffes are now being placed on the endangered species list. So we see loss of biodiversity, and we don't really understand the magnitude of how those impact our overall environment, but it's one of the consequences of all of these transitions and increased population growth. Urbanization is a major component of what we need to understand in terms of environmental risks. The majority of the world's population now lives in what's considered urban environments. It's changed dramatically in the last 200 years, and it's continuing to increase quite rapidly. And there are major hazards and benefits associated with living in the urban environment. Major hazards include exposure to biologic, chemical, physical, and built environment hazards. For example, in crowded urban settings, infectious disease may be transmitted more rapidly. We may find a higher concentration of chemicals in the urban environment because of increased fuel consumption. And the built environment itself may present hazards. So we may see hazards with road safety. We may see in the United States, for example, hazards with how communities are designed that contribute to lower physical activity, increased weight gain, and some of the diseases associated with that. Urbanization has major benefits too, including access to better health resources, a concentration of infrastructure and services in urban environments. But we have to understand that there are benefits and challenges to that. Those services and benefits are what draw people to urban environments. As we move through this semester, there's some key terms for you to understand and be able to describe and define. For this first module, there's a list here, and we'll go through them briefly. So be able to define what environment means, what the ecological model is, and what are the definitions of environmental health. So environment is really not perhaps just one thing, right? It's not just the physical things around you, but it's all of the things, physical, chemical, biologic, that act upon you or a community and determine its form and survival. And when we start to think about environmental health, we can think about things that influence health that are related to but not directly associated with measures in the environment. The ecological model proposes that the determinants or the factors that influence health are linked over the course of a lifetime. So we're talking about behavioral, social, biologic, and environmental. If we think about the ecological model, it has various levels. So if we look at this figure, we can see there are individual traits that affect your likelihood of getting disease that you may have no control over, that are inherited or just may be components of your biologic makeup. And then we have behaviors that may influence your health, your choices about health behaviors, be it physical activity or tobacco consumption. However, those choices are also influenced by your social networks, your family and community networks. So if you have an opportunity to be around others that are doing physical activity, it may make your individual behavior change and shift because of social norms. When we think about beyond those social conditions, living and working conditions, we start to understand that sometimes these behaviors and these choices are influenced by broader components: access to education, income. And we start to see that at all levels, these conditions, social, economic, cultural, and environmental, influence health. We think about how all of these work together. Think about the definition of an ecosystem. It's a dynamic community of non-living environment and plant and animal and microorganisms. And lastly, we come to the World Health Organization's definition of environmental health, which addresses all the physical, chemical, and biological factors external to the person and all the related factors impacting behaviors. So, for example, if you don't have access to water in the home and you have to carry it from a river or a lake or a fountain down the street, you may change your choices about hand washing. And this is an example of environment influencing a behavior. So environmental health can be very broad in its applications. It has a long history, which goes back to Hippocrates, where he noticed that the air was causing illness. It's been well studied, but in the most recent incarnation of environmental health, it really started out with physicians looking at people who had jobs that were making them sick. And it was occupational health conditions that really spawned what we consider the environmental health movement today. Occupations that caused people to be ill, and physicians started to notice lots of people with the same occupation having the same condition. And occupational health, where the concentrations of contaminants are much higher, is where we learn a lot of our approaches to understanding how environmental conditions can influence health. If we think about current topics that are relevant today, of course, I think climate change is a major example of things that the environment will do, that environmentally related components of your health. And climate change has far-reaching impacts from water quality to air quality to natural disasters. Perhaps more specific and concrete example, of course, is Flint, Michigan, where we saw changes in water going through pipes, causing lead to leach through the pipes and providing lead contaminated water to an entire city with substantial impacts on health that will be felt for decades. So as we start to think about where environmental health started and where it's going, it's important to understand that there's a long history of understanding how the environment can harm you and also make you healthier, and that we're understanding this more and more and understand that we have a duty to thoroughly investigate and support the role of environmental health as public health professionals. As you start to think about what this class means and how it can influence your career, I want you to think about there's lots of different careers that someone with an emphasis and understanding of environmental health can take on. Industrial hygienist is one that focuses on control of hazards in the workplace. A toxicologist examines how environmental chemicals can impact living creatures, including humans. And an environmental health inspector is an example of someone responsible for monitoring and enforcing regulations for environmental quality. If you go to any restaurant, they will have been inspected by an environmental health inspector at the county level. So in around campus. It's Fulton County that goes to the restaurant, has a list of items that they review and make sure that the food that's being prepared there is not going to cause you illness. And everyone has a score that they get based on a letter grade. This is the job of an environmental health inspector, and they're keeping you safe at the county level. But we can think about all the different roles that environmental health practitioners play in our lives. They do it at the local level, they do it at the state level, they do it at the national level, and they do it at the global level. And I hope this semester, with this brief introduction, will encourage you to explore more about environmental health.